Can you explain to me what an ACL is and why it is important for a young, active person to have a functioning ACL?
The ACL is the anterior cruciate ligament, and today in our society so many people pay attention to sports on all levels that they're familiar with that terminology, because an ACL injury to an athlete can be pretty devastating, at least for that season. The anterior cruciate ligament is a major structure that runs right in the middle of the knee. It's called anterior because there's also a posterior cruciate ligament. That is crucial for the young active person. If you have an injury, and the majority of these injuries are sports related, and often not in contact with anyone. A young athlete will plant their foot, stop, and their weight shifts and they tear this ligament. Once the recovery goes through, having a torn ACL doesn't necessarily hurt. And on a day-to-day basis, you can go to class, you can go to work, walk down the hall, and your knee may not be a problem at all. But for the young active person returning to sports, and that doesn't have to be competitive team sports, that can be recreational activity, that can be bouncing down the stairs. Without the anterior cruciate ligament working, oftentimes the knee becomes unstable, and then it will slip on the patient. Once again, that hurts, swells up, and often it's not uncommon that within the first year or so, depending on the activity level of the athlete or the student, this can result in additional damage, perhaps to the articular surface or the cartilage in the knee. And that's why oftentimes for the young person following this injury, we do have a serious discussion about surgical reconstruction, because that is proven to be the best way to restore the stability to the knee.